Okay, let me ask you something. What if we could actually lower healthcare costs, improve patient outcomes, and make doctors' lives easier, all at the same time? I know it sounds kind of like a pipe dream, right? But a new framework from Dr. Mostafa Bouattane says it's not just possible, it's already happening. And it all comes down to combining two huge ideas, value-based care and artificial intelligence. So in this explainer, we are going to break down his incredible practical roadmap for turning this vision into a reality. So let's just jump right into the results. I mean, what's the real promise here? The numbers are pretty staggering. First off, you're looking at a potential cost reduction of anywhere from 15 to 25%. That's a huge deal in healthcare. But here's the really crucial part. This isn't about cutting costs by cutting corners. No way. In fact, it's tied to a 20% improvement in the quality of patient care. Think about that. Better outcomes for less money. And believe it or not, it gets even better. Because this framework also tackles the human side of medicine, boosting provider satisfaction to over 80%. So let's recap. Lower costs, better care, and happier, less burned out doctors. You have to be asking, how is that even possible? Well, to get the solution, we first have to understand the problem. All right, section 1, the problem, healthcare's transformation challenge. And the subtitle says it all, why a new approach is so urgently needed. It's because, honestly, the whole industry is facing what you could call a perfect storm. I mean, just look at this. The system is being pulled apart from 6 different directions at once. You've got costs that are just skyrocketing and quality that's all over the map. At the same time, you've got a massive crisis of provider burnout. Then, on top of all that, you have patients who expect more, data that's stuck in 1,000 different disconnected systems, and regulations that just get more and more complex every year. It's a system that's pretty much at its breaking point. So, that brings us to the solution, the convergence of AI and value-based care. And this isn't just some small tweak. It's a fundamental paradigm shift. It's built on a really powerful idea. What if we could bring together a smarter way to pay for healthcare with the technology we need to actually deliver it? And really, at the absolute heart of this whole thing is a simple but totally radical shift, moving from paying for volume to paying for value. You know, for decades, healthcare has run on this fee-for-service model. It's the old way. The more tests you run, the more procedures you do, the more you get paid. It's a system that incentivizes quantity. But value-based care, it completely flips the script. It says we're not going to pay you for how much you do, we're going to pay you for how well your patient does. All of a sudden, the financial incentives are perfectly aligned with what we all want as patients, right? Care that's efficient, effective, and completely centered on us. Okay, that all sounds great in theory. A new payment model? Awesome. But it raises a huge question. How do you actually make that happen in the real world? How do you manage all that complexity? Well, that's where artificial intelligence comes in. Think of AI as the engine that makes the whole value-based care model run. It's the powerhouse. It can take those giant, messy mountains of data we talked about and actually turn them into insights a doctor can use. It lets us get proactive and predictive. I mean, spotting patients who are at risk before they ever get sick. And huge for doctors, it can automate so much of that mind-numbing administrative work, freeing them up to be, doctors. Plus, it helps hospitals optimize their resources, so every dollar they spend actually makes a difference. Which brings us to the core of this whole thing, Dr. Bouattane's 7-pillar framework. Now, this isn't just something he dreamed up. It's based on a deep dive analysis of 47 peer-reviewed studies and a ton of real-world case studies. This is a structured, evidence-based roadmap designed to take all this great theory and turn it into a practical, step-by-step reality. So here they are, the 7 pillars that make up the roadmap. And what I love about this is how holistic it is. You see, it doesn't just jump into the tech. It starts with the really important human stuff. Pillar 1, foundational readiness. Are you even ready for this change? Pillar 2, cost effectiveness. Does it make financial sense? Pillar 3, trust and transparency. Can you get people to buy in and believe in it? Only then does it move to change management and the technical implementation, and it finishes with the stuff that makes it stick: regulatory compliance and a culture of continuous improvement. It's the whole journey, from A to Z. Okay, so theory is great. A 7-pillar roadmap is great, but does this stuff actually work in the chaos of a real hospital? Let's get to the proof. We're going to look at how some leading health systems have applied this framework and what happened. First up, let's head down to Baptist Health South Florida. Their big problem? Their supply chain was a mess. We're talking escalating costs, massive inefficiencies with inventory. It was causing some serious financial pain. And you don't have to take my word for it. Listen to what their supply chain director said. It's a game changer for healthcare economics. I mean, come on, a game changer. That's not what you say when you make a small incremental improvement. That means they fundamentally transformed how they operate. And the numbers back it up. A 22% reduction in supply costs? That's a huge win for the bottom line. But look at the operational impact. This is what really matters for patient care. They hit 97% inventory accuracy, and they cut those frustrating stockouts when a doctor needs something and it's just not there by 63%. So what does that really mean? It means clinicians finally had what they needed when they needed it. All right, but this framework isn't just for back office stuff like supply chains. Let's look at Henry Mayo Newhall Hospital. Their problem was front and center, a totally bottlenecked emergency department. We're talking dangerously long wait times and, you guessed it, really unhappy patients. Now, check out this quote from their ED medical director. The key part for me is right at the end. No additional resources required. Think about that. They didn't solve this by hiring more people or spending more money. They just worked smarter. They transformed the process. And the results? Just wow. Using AI to optimize patient flow, they slashed wait times by 35%. And what happens when you do that? Patient satisfaction shoots up. In this case, by 28%. And they were able to increase throughput, get more patients the care they needed by 17%. It was a win-win-win. Okay, for our last case study, let's look at Western Maryland Health System. They took on one of the toughest, most expensive problems in all of healthcare, trying to stop patients with chronic conditions from ending up right back in the hospital after they've been discharged. And their chief medical officer just nails it here. The magic was being able to identify at-risk patients days earlier than they could before. That gave them a window to intervene, to do something before a crisis happened, and keep that patient healthy and safe at home. The outcomes here are just fantastic. An 18% drop in readmissions. That's huge for patients. That translated to over $1 million in savings every year. But honestly, the number on this slide that blows me away is the last one, a 93% provider adoption rate. That tells you everything. This wasn't some top-down mandate that doctors hated. This was a tool that clinicians actually embraced because it helped them do their jobs better. It just worked. So from theory to action, how do you start your own journey? I mean, the proof is pretty compelling, right? These case studies show this isn't just a nice idea on paper. So if you're thinking about this for your organization, what's the one thing you need to remember? It really all comes down to this quote from Dr. Bouattane. Success is not about the technology itself. It's not about going out and buying the shiniest, most expensive AI gadget. Success is about how you implement it. It's about having a plan, measuring your results, and always looking for ways to get better. It's about the framework, not just the tool. So if you're watching this and thinking, okay, I'm in, I want to learn more, here's how you can do it. The absolute best place to start is with Dr. Bouattane's book, Healthcare's AI Revolution. It's a super practical guide. You should also check out his newsletter, and definitely connect with him and other healthcare leaders on LinkedIn. Look, the path to really transforming healthcare isn't about finding some magic piece of tech. It's about having the right map. And this framework, this is the map. The only question left is, are you ready to start your journey?